our topic for this afternoon class is regarding the proper technique of breastfeeding, which is very essential to the nutrition of an infant. Let's define lactation, because lactation, the word lactation is very closely similar to breastfeeding. When you say lactation, this is the secretion of milk from the mammary glands. And this is also the period of time that the mother lactates to feed her young. Okay? So in short, yung period of lactation, this is the period where there is breast milk coming out from the mother's breast, no? From her mammary glands. The first milk that a breastfed baby receives, you call that the colostrum. So you see in the picture, this is the characteristic, no, or itsura ng colostrum. So you see it's not purely white, no, yellowish liquid siya. And this colostrum is very nutritious for the infant. That's why after delivery, right after delivery, we initiate breastfeeding, right away for the mother and child because of this colostrum. This colostrum contains higher amounts of white blood cells and antibodies than the mature milk. So you see how much beneficial it is for the infant to receive, no, white blood cells, thereby aiding, no, in the maturity and increasing the immunity of our infant. Kasi yung infant natin would have immature immunity yet. Kasi they are not exposed to any infections pa, no? But with the help of colostrum, yung mga white blood cells and antibodies from the mother will be transferred, no, to the infant once the infant receives the colostrum. So, itong mga antibodies that are formed from the mother, no, these are antibodies formed from previous infections that the mother has survived, no? So, lahat yun matatransfer kay baby, okay? Through the colostrum. Especially this one, immunoglobulin A, itong antibody na to, no? We actually call it as secretory immunoglobulin A or SIGA kasi secretory, but also known as immunoglobulin A or your IgA. When the baby receives the colostrum that is containing your IgA, this antibody particularly will coat the lining of the baby's immature intestines. So this can help prevent pathogens from invading the system and fight, no, or prevent food allergies. So over the first 2 weeks, the colostrum production slowly gives way to the mature breast milk. Okay? So very important to initiate breastfeeding as early as possible, okay? To maximize, no, this colostrum. Okay, let's discuss the pathophysiology of milk production. So the milk production is triggered by the sucking sensation, no? Yung sucking of the baby would send a sensory nerve impulse coming from the areola. So ito yung stimulant niya, the sucking of the baby. So this sensory nerve impulse will be sent to the brain. Okay? So your system will tell the brain that, hey brain, the baby is sucking the mother's breast already, no? And the brain receives these impulses from the areola, and what does it release, no? This hormone. It will command the hypothalamus, no, to release oxytocin. Okay, you know that your oxytocin is originally from your hypothalamus and is stored in the pituitary gland. Okay, so merong production ng oxytocin. Later on, I will discuss what is the purpose or the action of this hormone. So aside from the production and release of oxytocin, there is also the the release of lactocytes. No? These are coming from the mammary alveoli, and they start to produce milk in response to sensory nerve impulses. So you remember yung lactocytes, these are cells, no, in the mammary glands of the mammary alveoli. Sila yung responsible for the production of milk. Okay? Now, let's discuss ano ang purpose, ano ang action ni oxytocin. So, the presence of oxytocin will trigger the myoepithelial cells to squeeze milk. In short, magko-contract itong mga myoepithelial cells into the alveoli so that the milk will be squeezed out into the lactiferous ducts. So, this hormone is responsible for the let-down reflex, no? The milk let-down reflex, that's your oxytocin. So, isi-squeeze in niya yung mga milk papalabas doon sa lactiferous ducts until it comes out, no, of the mother's breast. Okay, what happens after the release of oxytocin? No? So there is production of milk, no, and squeezing of the milk into the lactiferous ducts. So anong mangyayari? The milk will start to pool in the lactiferous sinuses before being discharged into the nipple pores. Okay? So the increased milk production triggers increased suckling by infant. This is actually a positive feedback reflex. So what does it say? Once the continuous sucking will continue to increase the milk production. Okay? So mas dadami pa siya once there is continuous sucking. So that's a positive feedback. Milk flows from the alveolar cells where it is produced through small tubules to reservoir for milk. Lactiferous sinuses located behind the nipple. So yung milk na pinoproduce mo, initially, isostore mo na siya, no? Here, in this, what you call lactiferous sinuses. This constantly forming milk is called fore milk. So, every time the baby sucks, no, initially, yun yung lalabas first, the fore milk, okay? Because these are the milk that are stored, no? Initially. So, afterwards, the milk production would continue, okay? As the infant sucks at the breast, oxytocin released from the posterior pituitary causes the collection of sinuses of the mammary glands to contract. Okay? Yun yung action talaga ni oxytocin, no? It makes the myoepithelial cells of the mammary glands to contract, forcing milk forward through the nipples, making it available for the baby. So, of course, since na-store siya, then kailangan merong contraction to let the milk out of the lactiferous sinuses. And this squeezing out of the milk, no, via the contraction of your cells in the mammary glands that is stimulated by your oxytocin, ang tawag dyan is let-down reflex, or also known as the milk let-down reflex. So there are instances when breastfeeding is contraindicated. Only few, no? Few instances lang naman. These are the circumstances, okay? An infant na may galactosemia. So, galactosemia. These infants are not able to digest lactose in the milk. So, our breast milk is containing lactose. So, yung may galactosemia, which is actually diagnosed through newborn screening, no? Tapos may confirmatory test pa tayo after nyan. They have to receive lactose-free milk. Okay, yun yung this time they have to be bottle-fed kasi nga bawal sa kanila yung breast milk because of the lactose that it contains. Now, another contraindication are the herpes lesions on the mother's nipples. This picture here you see, these are examples of vesicular lesions in the breast. Okay, that's a herpes lesion. So that's one contraindication because very dangerous siya for the newborn, to acquire this viral infection. Okay? Pwede siyang, it can cause blindness, or heart problems. So, pwede ring deafness. Yun yung mga side effects ng viral infection. So, talagang bawal siya. No? Maternal diet is nutrient restricted, preventing quality milk production. So, kailangan yung diet ni mom is maganda rin, Balanced diet so that she will have a lot of nutrients along with her breast milk. So, kung si mom itself is malnourished, then it will also follow that the newborn will be malnourished. Kasi hindi enough yung nutrients na nakukuha niya from the breast milk of the mom. Kasi nga, malnourished si mom. So, this time, you need a supplement and the mother also has to improve her nutritional status. Another condition is when the mother is exposed to radioactive compounds, For example, yung mga ginagawang diagnostic test for thyroid mass, Kasi meron siyang radioactive material that is exposed to the mother and pwede siyang magstay in a while sa system ng mom, until such time na uuwi siya ng bahay, yung radioactive material can still emit radiation. So, bawal siya mag-breastfeed, Kasi may direct exposure to the baby. Okay? And she could transmit this radiation, okay, which is harmful to the genetic cells of our infant or newborn. Kapag may breast cancer, kasi usually yung mga may breast cancer, they have a lesion, Open lesions in the breast of the mom. So, bawal yan. And also, if the mother has an active, untreated tuberculosis, okay, so that is very infectious, she might transfer this bacterial infection to her baby. Kung meron din siyang hepatitis B, or C, so that is blood-borne, sa body fluids, pwede niya rin mahawa si baby. Cytomegalovirus, which is another viral infection that is very toxic to our baby, or your human immunodeficiency syndrome. Yung HIV ninyo, is also blood-borne, via body fluids. So, a contact of the body fluids, including the breast milk, can transmit the virus. So that's why it is contraindicated. So, another condition when breastfeeding is contraindicated, is when the mother has an active untreated varicella infection. So, what is varicella? This is your chicken pox, okay? The causative agent for that is your varicella zoster virus. So, anong gagawin natin if mom has varicella or chicken pox? Kailangan si baby maka-receive ng varicella zoster immunoglobulin. This is a type of immunization. Afterwards, kapag naka-receive si baby ng varicella zoster immunoglobulin, the infant can receive express. Remember, the mother has to express the breast milk. Okay? So, hindi pwedeng directly mag-suck si baby to the breast of the mother. So, the mother has to express the breast milk, store niya, in a clean container, and then i-feed niya to the baby. Okay? Kung may lesions naman sa breast. If the lesions are not found in the breast, okay, then you can breastfeed. Pero most likely, the lesions in varicella nasa trunk area kasi yan, So, most likely merong lesion sa breast. Okay? And then, bakit siya contraindicated? Similar to your herpes zoster infection, no? Varicella zoster would have a toxic effect also, yung virus, no? Leading to blindness, deafness, yun din yung kanyang mga effects to the baby. Within 5 days of the appearance of the rash, okay, maternal antibodies are already produced. And thus, pwede ka nang mag-breastfeed by this time. Okay? Kasi yung antibodies will be beneficial to provide a passive immunity against varicella to the newborn. When you say passive immunity, that means the baby has already antibodies against varicella virus. Okay? So, yan yung passive immunity. Other instances where you cannot breastfeed is when the mothers receive anti-metabolites, or these are mostly your chemotherapeutic agents. No? Yung nag-undergo ng chemotherapy are not advised to breastfeed. Okay? So mothers receiving prescribed medication that would be harmful to infant. Example is lithium methotrexate. Itong gamot na to is usually given to patient with bipolar disorders. No? Yung lithium kasi is very toxic siya if it is normal, more than the normal range. And the normal range of lithium is very narrow. No? Kapag lumampas ka doon kahit konti, very toxic na siya. So, for those mom, probably a psychiatric patient na mother, receiving lithium methotrexate, they are absolutely contraindicated to breastfeed. And a mother living in an area where environmental contaminants can be carried via breast milk to infant. Okay, very broad ito, no? But for those for example, the hygiene, the environment itself where the mother is located, or situated. And if it's very obvious, that instead of providing a safe and clean, nutritional feeding, to the baby, baka mas makasira pa sa kanya. But more likely, we always, aside from all of these contraindications, other than this, breastfeeding is highly encouraged. So what are the advantages of breastfeeding to the mother? So there are many physiologic benefits from breastfeeding. First, breastfeeding may serve as a protective function in preventing breast cancer. Okay? So not only to the baby, but to the mother, Ang laking ang laki ng benefit niya. It prevents breast cancer. And the release of oxytocin from the posterior pituitary gland aids in uterine involution. When you say uterine involution, we already discussed this. The uterine involution is the process wherein your uterus will come back, babalik siya sa non-pregnant state, okay? And that is aided by your hormone oxytocin. Successful breastfeeding can have an empowering effect because it is a skill only a woman can master. So somehow it will encourage, confidence to the mother that she is a good and able, mom to her kids, her children. Breastfeeding reduces the cost, So very financially beneficial also. Lowering the cost of feeding and preparation time. So imagine mo, magtimpla pa ka og gatas, magpainit og water, magpalit og mahalon ng breast, milk. So imagine that, Mumata si baby og alas 2 sa kadlawon para magdede. And unlike when you are breastfeeding, diretso paslak, kung gutom si baby. So breastfeeding provides an excellent opportunity to enhance a true symbiotic bond between mother and child. Okay, so every time there is breastfeeding session, no, it is also enhancing the maternal and child bonding. Okay. So, to the infant naman, what are the breastfeeding advantages to the infant? Earlier was for the mother. Ngayon, to the infant, the breast milk contains, this is what I mentioned earlier, yung SIGA, no? Secretory immunoglobulin A. This binds to large molecules of 4 proteins, no? Including viruses and bacteria, keeping them from being absorbed from the gastrointestinal tract into the infant. So, protective siya. Kasi yung intestines ng newborn or infant, sterile pa yan. There are no bacteria yet. So, this SIGA, secretory immunoglobulin, will line the intestines of the newborn. And when there is the presence of virus and bacteria, they will bind to it, no, to prevent it from being absorbed. Okay. Then there is also lactoferrin, no, that is present in the breast milk, which is an iron-binding protein that interferes with the growth of pathogenic bacteria. Okay, so more on immune benefits, no, immune system benefits to our infant. There is also what you call lysozyme, which is an enzyme found in breast milk, apparently actively destroy, very powerful enzyme. It destroys bacteria by lysing or dissolving the cell membrane. So, very very strong enzyme siya. It can dissolve cell membranes of your bacteria, possibly increasing the effectiveness of antibodies. So, it's an aid to your antibodies also. Once the cell membrane is destroyed, then the antibodies will be able to penetrate the pathogens. So, other advantages, breast milk contains the ideal electrolytes. So, these electrolytes, these are your sodium, potassium, calcium, magnesium. So, they have an ideal amount of electrolytes and minerals for a human infant growth. So, high lactose rin yan, which is an easily digested sugar that provides ready glucose for rapid brain growth. Okay? The protein in breast milk is easily digested, and the ratio of cysteine to methionine in breast milk favors rapid brain growth in the early months. Okay? So ito siya would refer to the proteins or amino acids that are present in your breast. Okay? So, see? Meron siyang benefit, no? It aids brain growth. Very important siya. Also, your breast milk contains linoleic acid, which is an essential fatty acid that helps to maintain skin integrity. So, less sodium, potassium, calcium, and phosphorus than do many formulas. Okay? So, ideal lang talaga yung amount, hindi sobra ng electrolytes, but very ideal, for an infant. Breast milk also has a better balanced trace elements such as zinc, and breastfed newborns appear to be able to regulate their calcium, phosphorus levels better than infants who are formula fed. Okay, kasi these two minerals, ito siya is an electrolyte, ito minerals. This has to be well regulated kasi it is also dangerous if you have too much calcium and too much phosphorus. So in a newborn that is breastfed, mas mature ang kanilang regulatory mechanism for these minerals compared to those who are bottle-fed. So let's see advantages. We will compare breastfeeding and bottle feeding. Okay? Unahin natin yung advantages of breastfeeding according to World Health Organization or WHO. Anyway, paulit-ulit ito. It's the same that I discussed earlier. So, breastfeeding, naturally suited to needs and digestion of infants. Okay? So, kumbaga, complete meal siya, no? For the infant. Complete and balanced meal. Ganun siya. Needs no preparation, less work for mother, ready on demand. Okay? Very convenient, no? For the mom. Inexpensive and clean. Okay? What else? Right temperature and concentration. No? Dili na ka magtansya sa timpla. Kasi perfect na siya, no? As it is. Contains protective elements for infant. Infant benefits from cuddling and close contact with the mother. This is your maternal and child bonding. Okay? May delay conception. Okay? This is what you call yung LAMP. No? Lactation amenorrhea method. However, hindi ito very reliable because it has a lot of conditions that the mother and baby should achieve, no? Para maging sure talaga na it can delay conception, no? Parang natural contraceptive method siya, no? Lang. So, it helps the uterus of mother to return to normal size. So, this is what you call, no? Yung oxytocin helping the uterine involution. So, what are the disadvantages? Meron bang disadvantage si breastfeeding? Okay. Severely malnourished mother who breastfeeds is depriving both herself and her child of nutrients. Okay. Magiging disadvantage lang ang breastfeeding if the breastfeeding mother is malnourished. Kasi imagine, kung malnourished si mother, take note, severely malnourished, anong ibibigay niya sa kanyang newborn na nutrients? Of course, the breast milk will also lack, no, the necessary nutrients for the baby. So in that case, kailangan niya ng supplement. Okay? And also, the mother has to improve her nutritional status. Okay? What are the advantages naman of a bottle feeding? Okay, so ano ba? Itong bottle feeding na to, these are not advantages for the baby, ha? Kasi it is never advantageous for the baby to be bottle fed. Okay, except na lang kung meron siyang galactosemia, no? Which is absolutely contraindicated siya na mag-receive ng breast milk. So advantages for the mother mostly ito. It allows the mother for more independence, ability to work away from home. Okay. But normally, in our institutions, mga offices, workplaces, we have a breastfeeding room already. And this is to cater lactating mothers. Okay. Allows so anytime, even if they are working, they can breastfeed their baby in that office or in that room. And this also allow other members of family to feed the child. Okay, pero I don't think next ano na lang siguro, no? After breastfeeding period na lang siguro mag-feed si lolo, si lola. Okay? But priority natin yung benefits na nakukuha ni baby from the breast milk. Okay? So, disadvantages of bottle feeding, ito marami. Of course, formula is expensive, no? How much ba yung isang, mamahaling gatas, no? Very mahal yan. One can, no? In my experience, not sa aking baby, no? But to my brother's baby, 2 weeks, 800 pesos. Baby pa yan. What if lumalaki na siya? No? What if lumalaki na yung demand niya for milk? Okay? Then formula needs to be accurately mixed for adequate nutrition. Okay? Yan. Takes preparation and time. No? Kasi timpla pa ka eh. If you go out, kailangan mo pa mag-prepare ng mga bags mo for the powder, the water, and all of that. No? And when you prepare, there's more chance of contaminating, no? Yung milk. Formula needs to be prepared using hygiene practices. Yun na yung sabi ko. Baby is more susceptible to diseases and infection when bottles are contaminated. Kasi the handling itself, no? Kasi ang dami mong i-handle when you mix, no, formula milk. Okay? Fuel needed for heating water, no? Ang gasol or ang electric heater mo, okay? For the water. Need adequate amounts of safe water to prepare formula and clean bottles. So aside from the milk, bibili ka pa ng water, no? Hindi kasi pwede yung nasa faucet, no? You need a sterile water for this one. More than one bottle is needed. Okay? So, ang biberon pa lang, mahal na daan. Okay? And need cleaning utensils and soap. So, manghugas pa ka, mag-sterilize pa ka o mga biberon. Okay? So, you see how inconvenient bottle feeding is. Aside from that it is not beneficial to your infant, no? But to the mother side also, very inconvenient siya. So, let's discuss na yung techniques of breastfeeding. Physical preparation, including itong nipple rolling. When you say nipple rolling, the mother has to stimulate the nipples. No? Kuhit-kuhito niya yung both nipples. Kuhit-kuhito until mag-engorge ang nipple. Okay? Before, this is advised. No? This is a way of making a woman's nip more protuberant. Okay? Para mag-engorge siya and mas easily mag-suck si baby. However, today, hindi na siya necessary because some of the women have inverted or non-protuberant nipples, no? Even with nipple rolling, anong iro-roll mo? Wala kang nipple dyan, okay? So, not necessary na itong technique na ito. Okay? Oxytocin, which is released by this maneuver. So, once you do this physical manipulation of your nipple, no, yung nipple rolling, you will release oxytocin, no? This will stimulate the release of oxytocin. And if you are also pregnant while you are lactating, it will stimulate preterm labor. So, that is a contraindication, no? Because baka mag-uterine contractions yan and preterm labor noon, no? Premature labor noon si mommy, kung buntis si mom. Okay? Breast massage. Okay? Breast massage is done to move the milk forward in the milk ducts. Kasi yung milk natin, magpundo yan siya sa mga ducts. So you have to aid the movement of the milk, no, in the milk duct. So therefore, yung breast massage is a manual expression of milk. So this is helpful, no, para easily siya malabas. This can help a woman who feels hesitant about handling her breast grow accustomed to doing so and allows her to assist with milk production in the first few days of birth. Manual expression, no? Breast massage or manual expression. This consists of supporting the breast firmly, then placing the thumb and forefinger on the opposite sides of the breast. So, thumb and forefinger on the opposite sides of the breast. Just behind the areolar margin. Okay? So, mag-start ka behind the areolar margin, then gently push, no? Pushing backward toward the chest wall, and then downward, no? Paatras muna, and then downward na naman until secretions begins to flow. Okay? That is your manual expression. I guess you will be I'm not sure, no, kung meron pa kayong completion nito. Because when I was a nursing student, we had this completion also, breast milk expression. At least 10 mothers yung kailangan namin i-milk, no? Tapos, i-collect namin siya in a clean container, tapos yun, bibigay namin doon sa NICU, no? NICU is a place where the newborns are temporarily doon sila, no? Kasi need ng proper monitoring or medication, no? Yung mga hindi well babies, so they will be fed with breast milk. So, beginning breastfeeding, what do we need to remember? Kailan mag-start, no? Should begin as soon after birth as possible. Pagka baby out, lagay mo si baby sa ni mom, chest, no? For skin to skin contact. After mo ma-dry, so you initiate breastfeeding already. So ideally, while the woman is still in the birthing room or while the infant is in the first reactivity period, no? Pagkalabas ni baby. Kasi once na feel niya yung nipple, no, the baby will start to crawl towards the nipple itself. So there are many nursing interventions, no, that we can give to breastfeeding mothers. First is to provide information regarding lactation and what are the proper positioning techniques, no? First and foremost, health education talaga tayo, no? Health education and awareness. Okay? So we can tell the mother that washing her breast is not necessary unless she notices a cake colostrum on the nipples. No? Kung wala naman, no need to wash the breast. What else? When she is first attempting to breastfeed, no, pwedeng ganito yung position niya. Lying on her side with a pillow under her head is a good position to use. So ganito, no? Para easier sa kanya. Or sitting position, pwede rin. So these positions relieve fatigue because it allows her infant to rest on the bed. Using a football hold with the baby supported on a pillow. So ganito yung football hold, no? Pero walang pillow itong picture ko. So you can also hold the baby like this for your breastfeeding, no, position. Pero this would take skill, no? Kailangan kasi yung muscles mo dito is also already sanay na siya to hold in such a way, no? So during the first few days of life, because they are receiving only colostrum and need the nutrients and fluid obtained by frequent sucking, so that means you have to frequently breastfeed the baby, at least, no, every 3 hours or every time there is a demand, no? When you see the baby is already hungry, kahit wala pang 3 hours, then you have to breastfeed. Then promote adequate sucking. So often a newborn being breastfed drops off to sleep, no? After yan magdede, tutulog yan, no? Most of the time, our baby is sleeping, okay? During the first few feedings. So it is necessary that we stimulate milk production effectively and ensure that we are adequately feeding the baby. Okay? So a woman may need to keep the infant awake and urge him or her to suck, no? Kasi tulog siya lagi, that doesn't mean na hindi mo na siya i-feed. As I said, no, at least every 3 hours. So kailangan mo talaga siyang ma-feed. Okay? Kasi otherwise mag-hypoglycemia si baby, which is very dangerous. And then provide immediate support if problems arise, no, to your mother, no? Kailangan niya physical support kasi very inconvenient din yan especially for first-time mothers, no? Ang pagpuyat pa niya, no? Emotional, as you remember, there is a sudden drop of hormones, no, right after delivery. So baka merong emotional turbulence si mother at this period. Mental, social, and especially nutritional. So you have to also ensure the nutrition of the mother so that the milk is also complete with nutrients, no? Provide information regarding techniques for burping. Okay. So some infants seem to swallow little air when they breastfeed, whereas others swallow a great deal. So because of this, you have to burp. You have to allow the baby to burp every after feeding. Okay. As a rule, it is helpful to bubble or burp newborns after they have emptied the first breast and again after the total feeding. So, ganito yan. Kapag nag-breastfeed ka, one breast at a time, hindi pwedeng palipat-lipat. Kasi when you breastfeed, one breast at a time, kailangan ma-empty niya muna yung isang breast. I-empty niya yun. Kasi kapag hindi yan na-empty, it will be, magkakaroon ng engorgement. No? Masakit yan. So, the baby has to empty one breast at a time first, and after one breast, kailangan mong magpa-burp. Okay, how do you do the burping, no? Yung iba, tinatapik gently yung back. But the technique talaga is actually to keep the baby in upright position. Ganito lang, kahit hindi nyo patapikin yan. You just keep the baby in upright position for 30 minutes. Yun yung burping method. No? Yung iba, tinatapik-tapik nila. Gently. Okay. So, yan. Before you proceed to the next breast, no? Kasi kung gutom pa si baby. Prevent or relieve engorgement. Ito na yung sinasabi ko. If you cannot empty the breast, there is a risk for breast engorgement kasi yung milk magpundo sa sulod, no? And have you seen a mastitis, no? Inflammation or swelling of the breast, very red and very painful. Dili noon ka maka-ano-ani breastfeed kasi very painful and probably, no? Baka maging traumatic siya for the mom. So this is what we want to prevent, okay, engorgement. The primary method for relieving engorgement is emptying the breasts of milk by having the infant suck more often or at least continue to suck as much as before. Now, kung hindi niya talaga ma-empty dahil busog na siya, you can express manually and then you store properly the milk. Okay? Okay, that is all for breastfeeding. Thank you.